Welcome to this Viva Learning webinar. Our topic is why are sterilization indicators and integrators so important for patient safety? And technology is important for the speaker's safety. My name is Mary Gavoni, and I will be the presenter for this webinar. And this is my contact information in case you have a question that comes up that we either didn't get to in the live program or you're listening to it on the recorded version. You can reach out to me and I'll show it again at the end of the program as well. This program is supported by Halyard, an Owens and Minor company. Halyard is dedicated to many infection control and infection prevention and control products, and is very dedicated to the quality of the use and the manufacturing of those particular products. So we thank you, our friends at Halyard, for your support of this program. So these are our objectives for this particular webinar. We're going to discuss CDC sterilization guidelines and AAMI Standard 79, which some of our listeners may not be familiar with, but hopefully you will be after this program. And how do they apply to validating the sterilization of our instruments and our equipment in our practices? We're going to differentiate between a sterilization indicator and a biological monitor. Biological monitors are what we call the spore tests. And we're going to identify various types of sterilization indicators and integrators and how we should be using them effectively in our practices to ensure patient safety. But the most important objective that I have for this course is to really address two issues: the why and the what. The why these are so important, why we need to be so concerned about patient safety related to instrument sterilization, and what do we use, what do we do to ensure that, and then that you are motivated to change your protocols in your practice if it's necessary. So the big why is, of course, patient safety. We owe it to our patients to not gift them with any kind of an infectious disease that they didn't come to the office with. So we need to make sure that our instrument sterilization protocols are up to date, are followed consistently, and that there's quality assurance that goes along with that so that we know that our equipment is functioning appropriately to help render those instruments safe. Some of you are probably wondering, why do we even need to think about or use indicators or integrators? Because if your spore tests or your biological indicators are negative, meaning they're passing, why do you need to do more? Well, there's a number of reasons. One is that you, according to CDC guidelines, should be spore testing your sterilizer or sterilizers, if you have more than one in your practice, on a weekly basis. So that means that at that single point in time in that load or for that load, your sterilizer worked properly and it killed all the microorganisms that were in that spore test medium. But what about all the other loads that you're running, that you ran during the week before you did the spore test? And what about everything that you do in between, for example, today's spore test and next week's spore test? The load may have reached the parameters for sterilization. In other words, you didn't get any feedback from your sterilizer that it didn't reach the right temperature or pressure, but was each pack of instruments or cassette exposed to the parameters? And that has a lot to do with how the sterilizer is loaded. And we probably load it a little bit differently every time, depending on the types of items that are being sterilized in that load. The other thing to consider is that the settings for a particular load may not be the appropriate ones for the types of items being processed. So we'll talk a little bit more about that towards the end of the webinar, but the very best thing I can advise everyone to do is make sure that you are following the manufacturer's instructions for your sterilizer, and you may have a couple of different ones from different manufacturers. Make sure you follow them to the letter in the manual that comes with your sterilizer. If you don't have one, you can go online or contact the manufacturer and they'll send you one. But make sure that you know, for example, what is the appropriate load setting, meaning time and temperature and so forth, for packaged versus unpackaged items, or instruments versus hand pieces. And you may have to run several different load settings depending on what's in that sterilizer in any given load. The other issue that we need to look at, and really what a lot of this information is related to, is risk management. If you are not ensuring that your sterilizers are working appropriately, and not just, again, at that weekly spore test time, but that every pack that you put in the sterilizer in every single load has been exposed to all the parameters needed for sterilization. And just to review those, that means the right temperature for the right amount of time, and that the steam in an autoclave is able to penetrate the packaging materials and contact the surface of the instruments in order for sterilization to occur. So not doing that is not following standard of care, which is a violation of ethical standards. Every single doctor listening to this program has taken an oath when they accepted their license to practice dentistry to follow certain ethical standards and to make sure that you do no harm to your patients. And so not following those standards can be a liability to the doctor individually, could be to other licensees in the office, perhaps a dental assistant who's licensed, or a dental hygienist, or an advanced care practitioner who maybe is licensed that works in a particular practice, and a liability to the practice as a whole. And that doesn't even consider negative publicity like what we've seen in the news over the last few years about the bacterial infections that were transmitted through contaminated dental unit water lines. These stories have been on the news. They were the subject last fall of a health alert from the CDC to dental practices about contaminated dental water. And so that certainly is not a marketing strategy that any practice wants to implement, because it's going to send patients running for the hills and being concerned about what could happen. So patients can sue if they believe that they contracted an infectious disease in the practice. It may not be well-founded, but that doesn't necessarily stop them from suing. So we need to make sure that we're following ethical standards and standards of care so that we are managing the potential risk when we're treating our patients. And I get questions about this all the time, like who sets the standard of care? And we're going to talk about that, what actually is the standard of care for sterilizer monitoring. And I love this definition of a standard of care. It's the benchmark that determines whether professional obligations to patients have been met. Did we meet our obligation to treat them in a safe manner and not expose them to any infectious disease? And failure to meet the standard of care is defined in legal terms as negligence. And I know no one intentionally wants to be negligent in treating their patients, but ignorance of what the standard of care is doesn't absolve you of liability if you weren't following the standard of care. And remember, we always have to think about this statement, do no harm. And it is the obligation of every dental professional, particularly those who hold a license to practice dentistry or dental hygiene or dental assisting, to know what the standard of care is and to follow that standard of care. So we're going to talk about that. So the what question that I have for you is, what do you use and who says we have to do it? In other words, who is setting our standard of care? The CDC is the primary driver of the standard of care for infection prevention and control in dentistry. I hope that everyone has learned this concept very, very well over the course of the pandemic. And there still are issues or concerns or questions that I come across working with dental professionals about, well, the CDC only issues or establishes guidelines. They don't establish regulations, so I don't really have to follow them. But the reality is that you do. OSHA's charge is to create regulations or standards that protect the safety of workers. The CDC and AAMI, which is another organization we're going to talk about in a bit, is responsible for setting the standard of care for patient safety primarily, but certainly CDC guidelines take into consideration the safety of team members as well. So these two documents, you have a link in your handout. If you use the electronic version, you can click on that link and go right to that document, and you can download it and save it and read it. The guidelines from 2003 from the CDC are in the process of being updated right now. Not that a lot of the information has changed, but we're looking now at a 20-year-old document. So the CDC wants to make sure that it appears to be more current than 20 years old. So in the CDC guidelines, either the sterilization guidelines that I didn't really talk too much about, but the guidelines for infection prevention and control in dentistry, sterilization monitoring is not just a periodic spore test. It's a combination of mechanical, chemical, and biological monitoring. So we should be taking a three-pronged approach to monitoring the effectiveness of our sterilizers. So biological monitoring needs to be performed not just on that weekly basis that the CDC says, and some of our listeners may not be aware of the fact that your sterilizer must be calibrated or monitored with a BI or a spore test when it is installed in the practice. And there is a protocol for this, and that is that there must be 3 consecutive passing tests before that equipment can be used. So that's number one. Then next, is, of course, is the weekly monitoring of sterilizers. And then if a biological indicator is positive, meaning there was growth when it was processed and it didn't pass, you must take that sterilizer out of service and retest it. If the second spore test fails, the sterilizer must be serviced. And then once it is serviced, it has to then again be recalibrated with those 3 consecutive biological indicators. If you move your sterilizer, I'm moving it out from where it sits on the countertop to clean behind it, or I'm moving it to a different location in my sterilization area, it can throw things off. It can affect the mechanical function of the sterilizer. So if that happens, then you must again recalibrate and do 3 consecutive biological indicator or spore tests before it's used. And they, of course, all have to be negative or passing. If you make major changes to the type of packaging that you use, you switch from one type of a pouch to another. Maybe I was using cut to length tubing, nylon tubing instead of sterilization pouches, or I'm now wrapping cassettes as opposed to putting cassettes in pouches, those types of things. Or if you change how you configure the loads in your sterilizer, then you also need to run a spore test with those. We have a question, I think, that's very important. What about stacking cassettes on top of each other in the sterilizer? It may or may not be appropriate depending on the manufacturer's instructions from your particular sterilizer. So every brand of sterilizer comes with manufacturer's instructions for use. IFU is the acronym that's used. And you must follow their loading guidelines. And if you're not sure how to do it, then contact that sterilizer manufacturer and find out what they recommend. There are load maximums, in other words, how many cassettes or how many instrument packages you can put in a particular load, and so forth. So always follow the manufacturer's instructions for use. The important thing is that you have to allow for the circulation of steam in that autoclave, because remember, it has to penetrate into the packages. So I mentioned earlier that sometimes people will mistake a biological indicator or a spore test, or excuse me, it's the opposite. They will mistake a chemical indicator, either the indicator on a pouch or a strip that's placed in a pouch or a cassette. They will confuse those with biological indicators. In other words, if I use an indicator in every sterilizer load, that means that my sterilizer is killing all the microbes. And it probably is if that particular integrator or integrating indicator passes, but it is not the absolute validation of a spore test that we know we've killed all the microbes. So that's a given, must be done. And then we look at the mechanical indicators and the chemical indicators as the backups, as the bridge between the spore tests. So mechanical indicators are those that are actually on your sterilizers. They're the gauges, they're the dials, they're the printouts that you may get from your unit. One of the things that the AAMI standard that we're going to talk about in a bit says that if you have an older style sterilizer that does not give you a readout at the end of the cycle, then you shouldn't use that sterilizer. You either need to get a special unit that you can attach onto your sterilizer that is a separate little printer that you can attach onto it, or you purchase a sterilizer that gives you that information. So you've got documentation that that particular load met all the parameters. Now, that's not something we've been used to doing in dentistry a lot. If we have any listeners from Canada, you know that that is a requirement in Canada. And in the Canadian provinces, you must do a spore test on your sterilizer at the beginning of every day, and you are not allowed to operate your sterilizer to process instruments until you have the results back from that biological indicator. And so what the dental practices in Canada use is an in-office spore testing system that gives them a very quick result in typically under 20 minutes. Then we look at chemical indicators, and chemical indicators come in all kinds of different forms, which we'll talk about. Chemical indicators will use chemicals to measure or assess whether or not the sterilizer has met the parameters necessary for sterilization. Again, time, temperature, pressure, or steam penetration. And some of them measure only one parameter, like temperature. Some will measure all three. But again, it's not an absolute validation like a spore test is. So the most common chemical indicators that are used in most practices are the ones that are incorporated into pouches. There are both internal and external chemical indicators on most pouches. You can see in the circle on the picture on the bottom right of the slide, the outside indicator typically is a single parameter, measures temperature change. And the indicator that is inside of or underneath the plastic layer of the pouch is typically the one that measures 2 or all 3 parameters needed for sterilization. If you use pouches that only have external indicators, you need to add a strip into the pouch that measures at least 2 of the parameters, preferably all 3 parameters for sterilization. If you use a cassette and you wrap the cassette, you need to put an indicator strip inside of the cassette. Many people are of the understanding that autoclave tape is an indicator of sterilization. Autoclave tape is only a process indicator. It only means that something has been processed in the sterilizer. It does not mean that the instruments have met all the parameters needed for sterilization. So if I seal up my instrument cassettes or packs, if you're bundling perhaps some surgical instruments and items used during an oral surgery procedure, I wrap them in CSR wrap, or I might do a cloth wrap on them and I seal it up with autoclave tape. Inside where those instruments are or those items are, you need to have a chemical indicator strip that tells you that the steam penetrated into that package. Now, there may be some people sitting out there listening to this saying, oh yeah, but does it really say that? And so here are excerpts directly from the CDC guidelines for dentistry that talk about how to or why we use biological indicators, because they're the most accepted method and they directly assess whether we're killing microorganisms. And then talking about the chemical indicators and how they don't prove sterilization. So if you download a copy of either the CDC guidelines for infection control in dentistry from 2003 or the guidelines for disinfection and sterilization from 2008 and updated in 2019, you will see much the same information. So for anyone who needs to take that information back maybe to an employer or to someone that they report to prove that that is the standard of care, there's where you find that particular information. This is directly from the guidelines for disinfection and sterilization in healthcare facilities that I just mentioned. And here's more information that talks about not putting a sterilizer back into use until the biological indicators are negative, that it's been tested. And also, if you are using a pre-vacuum sterilizer, at the beginning of each day, you have an additional monitor that you need to do, which is called a Bowie-Dick or an air removal test, to make sure that that vacuum, which is part of helping the steam to penetrate into the packages, is actually working. So Bowie-Dick tests must be done on pre-vacuum sterilizers at the beginning of every day. And again, that information is in those guidelines from the CDC. Now, I've been sort of alluding to a group called AMI. And AMI stands for Association for the Advancement of Medical Instrumentation. And they have a number of standards. The one that's the most important to us in this context is Standard 79 about sterility assurance, and it applies to all healthcare facilities. So while these are not mandates, they are voluntary standards, this is part of the standard of care, just like guidelines from the CDC are the standard of care. Now, the downside of AAMI, if there is one, is that we can't, well, you can, but it'll cost you. You can't go to AAMI's website and just download a free copy of the standard. It will cost you $400 and change to purchase the standard. It's not public domain information like the CDC guidelines are. If any of you are governed by the Joint Commission on Accreditation for your healthcare facility, it would most likely be worth your while to invest in an updated copy of ST79 so that you are very much aware of what it says, because the Joint Commission relies very heavily not only on CDC guidance, but on AAMI guidance and AAMI standards as well. Another question we have is the color change under the plastic in an autoclave bag considered multi-parameter? Great question, and the answer is it depends. It depends on the manufacturer of the pouch. So you need to research your pouches as you're buying them, and the manufacturer will tell you, is it a certain type or classification, which we're going to come to in a bit. They have to tell you how many parameters are measured or indicated by that indicator. The good news is that if you're using a pouch that has an internal indicator that meets one of the standards of care, but when we talk about the types of indicators, you'll see how important that is. So one of the cautions, and I will repeat this again at the end, that I always tell people is beware of purchasing any dental supplies, but in particular, anything associated with sterilization from sources that are unverified. And a really common unverified source lately is Amazon. Now, I am not criticizing Amazon. I shop at Amazon all the time. However, Amazon is not a dedicated dental distributor. They don't necessarily vet the products that they sell. So some of the products that they sell are either gray market, or they may be counterfeit, or they're ones that are manufactured to standards other than US standards. And any sterilization pouches used in the US, same thing with indicators, sterilization indicators, must be FDA cleared, and they may not. So you need to rely on manufacturers that you know and trust, and distributors that you know and trust for purchasing those supplies. And we're seeing a big glut now of dental materials, restorative materials that are counterfeit, that are knockoffs, and they are not working like the other materials are. And people will purchase them because they're cheaper, or maybe they can't find them through their normal distributor. And then they're having all kinds of issues with those particular products. And dentists are required to use products that are FDA cleared. So AAMI is very specific, and here's some language from their standard about following the manufacturer's IFUs, or instructions for use, to how to operate the sterilizer, which cycles you should use and which parameters, depending on what you are sterilizing and what they're indicated for. And one of the common mistakes, I think, that people make with sterilizers is buying what is called an immediate use sterilizer. Best known of these is a Statim sterilizer. A Statim sterilizer used to be called a flash sterilizer, and that terminology has changed over the years to immediate use because it's more descriptive of what it was designed for. It was designed for a short cycle with unpackaged items. And when they first came out on the market in dentistry, it sounded like a gift from the heavens because we were starting in the early 1990s to sterilize handpieces, which many practices didn't do before that. And it was less wear and tear. It was a shorter cycle. We didn't package. And so it was a quick turnaround. But it really is meant, its intended use, its FDA clearance states that it is used for items that are contaminated during a procedure, must be re-sterilized because there aren't replacements for that particular item. And so they are sterilized through that quick unpackaged cycle. And then they are removed and they are cooled in sterile water and put back into use. So in the operating room at the hospital, that's what they're designed for. They're not meant for routine use in a dental practice, but many people have them because they like that shorter cycle. And yes, I know that many of those units have a packaged instrument cycle, but just know that that's truly not what they were meant to be used for. And we have another question. When using a dental hygiene cassette with all the slots wrapped with blue paper and indicator tape, we have to use an inner indicator to tell if the steam penetrated properly. Absolutely. Autoclave tape is only a single parameter indicator. It only measures temperature. And so it tells you nothing on the outside with that single parameter indicator whether the steam has penetrated. Now, is it likely that it didn't penetrate into the cassette? Probably not. But what if your sterilizer manufacturer says it's okay to stack cassettes, and now I've got too many stacked if I could squeeze them into the chamber in the sterilizer, and perhaps the cassettes in the middle of the stack don't get good steam penetration. So that's why you need that indicator strip inside of a cassette or inside of a pouch that has only an external indicator. Okay, so hopefully that is that's helpful information. This is some more information that comes from the AAMI standard, and they talk about using chemical indicators in accordance with the manufacturer's instructions. So don't just assume that one manufacturer's chemical indicator strip is the same as another's. Whatever it is that you're using, make sure that you've read the instructions and that you use it appropriately. That is following the standard of care. Question, should we be using instant sterilization? I think you mean immediate use sterilization for Cavitron tips inside cassettes. Follow the manufacturer's instructions for the ultrasonic inserts. I would certainly put an ultrasonic insert inside of a cassette. Hugh Free makes some great ones that have little rubber kind of like fingers. They remind me of the baby bottle draining racks. They have those little rubber fingers that stick up and they cushion the insert so that the bundles, the magnetostrictive bundles don't get kind of banged into each other. So you have to follow the manufacturer's instructions for use. If they say that you can put them in an immediate use sterilizer, packaged, Yes, but again, keep in mind, it's not meant for routine use. It's meant for immediate use. Now, if you're short on inserts, then there you could make a rationale for that. Now, there are 6 types of chemical indicators that are available. The ones that are highlighted in teal are the ones that are typically used in dentistry. A type 1 is a process indicator only. It just means that whatever is in that pouch or cassette and has autoclave tape around it, which is the most common example of a process indicator, it just says that they've been exposed to the sterilization process. It does not validate that they've been sterilized. It validates that they have been processed. Okay, so type 1 indicators, again, are really used primarily to seal a package, seal a cassette, seal an instrument bundle, maybe an oral surgery pack, or to seal pouches. Then the type 4 indicator that is typically used in dentistry is a multivariable indicator. So depending on which pouch you use, which indicator strip you use, it will measure 2 or more of the variables for the sterilization process. And you have to read the product information to know whether or not there are 2 or whether there are 3 variables that are measured by that type 4 indicator. And that's something that's a color change, what we talked about on the pouches. So I can't tell just because it's an internal indicator. I have to go to the manufacturer of the pouch to find out how many parameters does it actually measure. And the best pouches you can get are the ones that have a type 4 indicator incorporated into the pouch that measures time, temperature, steam penetration. But you have to make that choice based on the types of pouches that you purchase for use in your practice or facility. Now, the one thing we didn't talk about yet was, what do we do with each sterilizer load? And I'm going to show you a protocol in a minute. But for each sterilizer load, each load that you run throughout the day, you should put 1 type 5 integrating indicator in the load. That validates that not only did the pouch exposed to the parameters for sterilization, but the entire sterilizer worked as it was supposed to reach the right temperature for the right amount of time and with the right amount of pressure. This is not to replace a spore test, but it's something, as I mentioned earlier, is kind of the fill in the gap between the spore tests. And we'll talk about what you do if you get failures either on a type 4 or a type 5 indicator. So an integrating indicator, and they call these moving front indicators because the type 4 indicators just have a color change. They have a couple of squares or some dots or something that will change color. A type 5 integrating indicator actually has a chemical inside of it that melts at the right temperature and at the right pressure. It moves along sort of a tube or a space inside that indicator to the pass section. And if there isn't enough pressure and the chemical that's inside hasn't melted appropriately, it can't get through the barrier from the fail side to the pass side. If that, hopefully that makes some sense. I'll show you some examples in a minute. So again, we use type 1, type 4, or type 5 indicators in our dental practices. So type 1 indicators, autoclave tape. The lines show up black when the sterilizer has the items have been processed in the sterilizer, and that is a temperature indicator. Type 3 or type 4, again, external and internal on a pouch. And you, again, have to contact the manufacturer to know which type of indicator, how many parameters they can claim based on FDA clearance for measuring, validating on that particular pouch. Now, these are type 4 indicators that you would place in a cassette or in a pouch that only has a type 1 indicator. And there's, again, just a color change that says whether it works or doesn't work. Then we go to the type 5 integrating indicators. And these are the ones that I said before were moving front indicators. So here you have an unprocessed indicator. We have one here that's failed because either the chemical that's inside did not melt, become liquefied because the temperature wasn't appropriate, or there wasn't enough pressure to push it along this channel to the pass section. Same thing with these. There's a channel, there's liquid inside, it gets pushed along by the steam, and as the temperature raises and it liquefies the chemical that's inside, and it reaches the pass. Lots of different manufacturers of these types of integrating indicators. This is what goes in every load of instruments being sterilized. You don't need to save them. I get questions about that all the time, wanting to know if they have to save them, if they have to document them. All you really need to do is make sure that you are documenting, unless you're in Canada because you have other requirements to do, but in the US, that you're documenting as part of your protocol that you run one in every load. So we've got a couple questions I want to answer before we move on. Is it imperative to use cold sterile solution for plastics that can't go in the autoclave, or is a spray sufficient? Cold sterile is no longer referred to as cold sterile. It is called a high-level disinfectant, and it is an immersion product that actually is capable of sterilizing. The problem is, and why we don't use it routinely for other items, is that once you take those items out of the solution, even if they were in long enough and the solution met all the parameters, the right concentration and so forth, once you take them out, they're exposed to the room air and you rinse them with tap water, they're no longer sterile. Those are appropriate for items that are used in the mouth, that touch mucous membranes, that need to be decontaminated after use. Simply spraying them with a surface disinfectant, which is not as broad spectrum as a high-level disinfectant, is not acceptable. But the items have to be able to be immersed. But my recommendation always is make sure that things like suction tips or cheek retractors and the like, make sure that there isn't a heat sterilizable version of those, because there are, for most items now, that are used in the mouth. So do your research, vet your products before you use them, and they most likely can be heat sterilized. A lot of times we make the assumption that they can't be, but spraying them with a disinfectant is not appropriate. They must be immersed in a high-level disinfectant if they have been used in the mouth. Now, having said that, please don't go and dunk your X-ray sensors into the high-level disinfectant. Follow the manufacturer's instructions. Always follow those instructions. And if you can protect those items with a barrier, especially the electronics, the sensors, the intraoral cameras, then that is what you do. Make sure you always read the manufacturer's instructions for those electronic items that you shouldn't have in contact with any chemicals. So be careful, read your instructions. There's not one hard and fast rule. Next question, is it acceptable to use one type 5 chemical integrator strip in the load by itself, not inside a cassette? Thank you for asking that question, because that is how it should be used. You don't put it inside of a cassette. You use a type 4 inside of a cassette, and you still add a type 5 in the load, because remember, we're monitoring were the instruments in the cassette exposed to the appropriate parameters for sterilization, and then we're monitoring chemically the effectiveness of the load. So you can't do either or, you need to do both. Another question, once sterilized, how long can you store pouches or wrapped cassettes so that they can be used safely? That's a great question. I hear that a lot. With the types of materials we have for pouches now, studies have shown that even after 2 years, the instruments can remain sterile inside of a sealed pouch if the pouch is sealed appropriately and the instruments were not taken out of the sterilizer until the packaging was dry before they were put into storage, and there's no perforations or punctures, no instruments sticking out, which can compromise the sterility of the instruments inside, exposing them to room air. So you don't need to date the packages and then say, okay, this one's been in the drawer in storage for 60 days, so now I need to process it before I use it again. That does not apply with these types of packages. It has to do with the integrity of the pouch itself. Another question, is it more common to the type 3-4 in a dental office? I'm not sure exactly what that question is asking, so if you could clarify that, the asker of the question, that would help. Next question was spore testing. Do you run with an empty load or with a regular load? You run the spore test with a loaded sterilizer, and you follow the manufacturer's instructions for where you place that spore test. And what you're going to find is that the manufacturer of the sterilizer and the manufacturer of the spore test sometimes make different recommendations. And according to the AAMI Standard 79, follow the sterilizer manufacturer's instructions for where you place that spore test. And it's typically in the most hard to reach area in the sterilizer where the temperature might not be consistent, and that's usually closer to the door. So I'm not sure why someone would have said to run it on an empty load without instruments, unless that sterilizer was brand new, then you run it on an empty load, or it's been serviced. You can run it on an empty load, but if you're doing your weekly spore test, you run it on run it in a load of instruments according to the manufacturer's instructions. And again, if they differ, follow the equipment instructions. So here's the protocol. Here's the scenario for monitoring each load. So you're going to use a type 3 or 4 indicator for each pack, either incorporated into the pouch or a strip you place in a pouch, pack, or a cassette. That's number one. Then we're going to put a type 5 integrating indicator, I can't even say it right half the time, in the recommended position by the manufacturer's instruction for use that monitors the load. The first layer is monitoring the pouch. Second layer is monitoring the load. And then when you open the sterilizer, after the drying cycle has completed, then you look at your integrating indicator to see if the load passed. If it passed, great, you can release all the packs of instruments. If it failed, you repackage and you reprocess all the items in the load, even ones where the indicator on the pouch changed color. If it didn't pass for the whole load, you reprocess the whole load. If the load passed, but individual packs fail, then you just repackage and reprocess those individual packs where the indicator didn't change color. So this takes a little bit of time to develop that habit of checking that item first and then checking each pouch or each cassette. When you open it up to use it, make sure that you're checking that before you use the instruments. So that I don't confuse anybody here, if I'm using pouches and I notice that the indicator that I can see through the pouch has failed, then I should not use those instruments. But I cannot tell you how many times I hear from practices that will say, oh my gosh, as we were cleaning up the room, we realized that there was no color change on that pouch of instruments we just used on the patient. And panic will set in, trust me. So we check them, every pouch, every package, pouches as we take them out of the load. Now, you are not going to unwrap the cassettes when they come out of the load. You do that right before you're going to use those instruments on the patient in the treatment room. And you check it. If it failed, then you send that back to sterilization and you get another cassette of instruments. And I have seen that happen a couple of times in practices when I was there consulting. The first time it happened, the hygienist just absolutely lost it. Oh my God, this failed. Oh my gosh, she's almost hysterical. And like, okay, calm down. It's going to be okay. And we explain to the patients, this is an extra thing we do in all of our instrument packs to make sure that they're safe for use. This one, we noticed, isn't. So we're going to get another one. And they bring another cassette in, they unwrap it, they check and show this one has passed. And so in this particular instance, the patient wanted those indicators. They wanted to take them with them, and they took them back to work and they showed them to their coworkers. This is what my dentist does to make sure the instruments have been sterilized. Isn't this cool? And I told the team, make sure that you are tracking referrals. And they found out from this one patient where that incident happened, they got 6 or 7, last count, new patients just because of that, because patients are concerned about, are my instruments sterilized or not? So again, I'm just going to go through this again. The first layer is incorporating either the indicator into the pouch or putting a strip in a cassette or a pouch. Then we put a type 5 integrating indicator in the load, and then we evaluate those indicators when we take items out. First one would be the load, the type 5. If it passed, release the instruments once they have been examined to make sure their indicators have passed. Okay, let's see what we've got here. Few more questions. Is it more common to see type 3 or 4 in the dental office? I see a little bit of both. Excuse me. It depends on the preference of who's buying the supplies, the pouches, and so forth. But if you're only using type 3, which may not be measuring all 3 parameters, or a type 4 that is measuring all 3 parameters, then you get a little better level of protection or information from a type 4, but you have options. Oh, another very good question. Am I saying we don't need to use a date stamp for sterilization anymore? No, that's not what I'm saying. And thank you for asking that question. What I meant was that you don't date stamp your pouches because they have an expiration date. You date your pouches in case there is an incident. So I've used, or I've run my spore test and it failed. I need to go back and see in that time period, that week between spore tests, what packages of instruments have not been used yet. And the way I know is that I put a date on them, and ideally you should also put the sterilizer that you used, and you number your sterilizers. So it's July 18th, sterilizer number 1. So that you know which instruments may need to be reprocessed if you had a failure. So thank you for asking that. I want to make sure that's clear, because I'm not saying that you don't need to date stamp your pouches. After you do your monthly cleaning of the autoclave and have emptied and refilled it, do you need to run a test? I think you mean a spore test, or just run a cycle to make sure you follow the manufacturer's instructions. There isn't a need to spore test after cleaning, but the manufacturer's instructions say maybe run a cycle after you've cleaned it. And let's go to one more slide here, and then we'll do some more questions. These are the most common errors that I see with sterilization indicators. Number 1, substituting those type 5s for biological indicators, because they so closely emulate a biological indicator, but they do not test for microbial kill. Another one is, and it's very common for practices, not to put the type 5 indicator in each load. And that's what you need to do. Each load needs a type 5 indicator. Failure to repackage and re-sterilize items if the indicators show a failure. You should, excuse me, you should not simply take those pouches and run them through another cycle. Pouches are only meant for one cycle. So you repackage and you re-sterilize them in another load. And then I mentioned this before, make sure that you are purchasing your indicators and packaging materials from a trusted dental distributor and manufacturer, not from unverified sources. This is not the place to try to save money and potentially put your patients' health and safety at risk. Okay, let's see. Couple of other things that you need to make sure that you are following. Make sure that you always know what the instructions for use are for your particular sterilizer, and make sure you are running the appropriate cycle depending on what is in that load. And assuming that one particular load can do all types of items is incorrect. And hand pieces, if they're run on an inappropriate load or they're mixed in with other things, may not be sterilized. So make sure you're following the manufacturer's instructions. So this is my contact information. You can use the QR code if you want a screenshot. You can go to my website. It's kind of in disarray right now. We're doing a new website. So make sure that if you have a question, go ahead and email me, and then we're going to answer a few more questions before our time is up. We were told to save all of our spore test strips that we run in each load. Okay, so first of all, the strip that you run in each load isn't or shouldn't be a spore test. That is the integrating indicator. It's a chemical indicator. And no, you do not need to save them all. You don't, there's no need to, but make sure that your infection control protocol is in writing for your practice, that you always put the type 5 integrator in each load, and what your protocol is, what we just talked about, that if it fails, then you repackage and reprocess. You don't need to hang on to those. You do not need to keep those. Next question or statement, please review mandate not to have any extra instruments open in a drawer and not kept in a sealed sterilization pouch. Absolutely. Thank you for bringing that up. Any additional items that you have that are extras, maybe you have an emergency setup that's a mirror explorer and maybe a cotton plier, and those items should always be packaged. You may want to package them together. What some people do is take a whole bunch of mirrors and a whole bunch of explorers and put them all in one pouch, and then open up the pouch and take one out at a time. Once you open the pouch, they're no longer sterile, and they absolutely should never be stored unpackaged in a drawer because they are subject to cross-contamination. Yes, type 5s go into each load. Just as a clarification, a type 5 goes into each load. What if a CDA refuses to wrap all of the instruments? That is an internal issue that needs to be dealt with, because the CDC guidelines says that everything must be packaged prior to sterilization and remain in the package sealed intact until it is used. So if I'm the employer and I have an employee who refuses to do it, I would invite that employee to be part of someone else's dental team, and they would not be employed in my practice. So that's not following the standard of care. My school gave us cloth sterilization pouches. Do you feel they are more effective than paper pouches during the sterilization cycle? I will tell you, I have very mixed feelings about cloth sterilization pouches, and this is why. They are difficult to seal, and what we know about our paper pouches is that you need to fold them on the perforation at the flap and seal them so that they're not exposed to room air when they come out. Manufacturers of the cloth pouches will say that you can seal them with autoclave tape. Some of the fabric pouches don't allow the autoclave tape to stick, so then you've lost the seal. The other thing with cloth pouches is they have a finite number of uses. The point of the cloth pouches is that you can reuse them instead of throwing them away after every use. But someone somehow has to track how many times those pouches have been used before they need to be replaced. And I think that that is a nightmare for people to try to track in practice. And people lose track, they keep using them. The other issue I have is that some, not all of them, some of them after they've been processed a number of times start to look brown and dingy from the heat in the sterilizer. And I think that sends the wrong message to patients who want to see clean and pristine. Is it mandatory to have a digital readout on the autoclave? Is it acceptable to record manually on a sheet by the operator? Well, it depends on which standards you're being held to. If you are in a facility that's accredited by the Joint Commission, then you need to be following AAMI standard ST79, and they say if you can't get a readout, you shouldn't use that sterilizer. If you're going to do it manually, but you're not accredited, you don't have to face an accreditation review, then yes, you probably could. Some people will take a picture and save a digital picture of the controls. There are ways to do it. If I have a dual process indicator pouch, do I also need to put a level 4 strip inside that pouch? I'm assuming that you mean by a dual process indicator that you have an external and an internal. You don't need to put another strip inside the pouch. No, you do not. You either have them incorporated into the pouch. If you use a pouch that does not have an internal as well as an external, then you put a strip in it. And same thing in a cassette. You have to put a strip in because you don't have anything that's been incorporated. Oh, well, I think we made it through all the questions. But if anyone has any questions that they want to follow up with me on, please send me an email. Please put Viva Learning in the subject line so that I know where your questions come from. Thank you for your participation. And we have some information for you about getting your CE certification.